Physician-assisted suicide, or PAS, is the act of ending one's own life with the aid of another person, usually done with the provision of a lethal drug. This isn't to be confused with euthanasia, which is the direct act from a third party to end the patient's life, usually one in an incurable state. This is done based on the humanistic desire to end their suffering and pain. There is a process the patient must go through in order to be approved for PAS. A psychiatrist must be requested to evaluate the patient's capacity to give consent. It also requires the patient to have a terminal somatic illness that causes immense mental suffering. The states that allow PAS are Oregon, Washington, Vermont, Montana, and as of 2015, California. Fewer people oppose the movement now than 3 years ago. 70% of people were for it, but now this percentage has increased by 4%.
Dr. Swangard, an anesthesiologist from California, is one of the few people that can relate to this from both sides. Dr. Swangard has seen patients die in hospitals hooked onto morphine drips and overcome with anxiety. He has watched death drag on for weeks or months as terrified relatives stand by helplessly. In 2013, Swangard was diagnosed with a rare cancer that required parts of his liver and pancreas to be removed, including his entire spleen and gallbladder. It was a successful operation and his cancer is in remission. Swangard wants to continue practicing medicine and continue his lifestyle, but if the cancer returns, then his chances of coming back from it are very slim. He won't say if he'll take the medicine, but if it came down to it, he would want to make the decision on his own.
Stories like this most likely led to the Right to Die movement, which started in 1975. In 1975, Derek Humphrey, the father of the Right to Die movement, helped his wife with breast cancer to take her own life. He founded the first Right to Die organization in the US in his garage. In 1990, Suicide Machine takes about 130 people's lives. In 1993, a law passed by the legislature banning assisted suicide. In 1994, Oregon becomes the first state to legalize doctor-assisted suicide. In 1999, Kevorkian is convicted of second-degree murder assisted in a suicide. In 2004, a group of activists form its own group, Final Exit Network. They aim to assist death to anyone who wants to die. In 2009, Final Exit Network members arrested for helping the death of John Kelmer. In 2012, Final Exit Network wins in Georgia and Washington. In 2016, in the case of Carter versus Canada, the Supreme Court of Canada ruled that criminal prohibition on assisted suicide violated their rights to life, liberty, and security of the person. This was only allowed in special circumstances. The Right to Die movement uses physician aid in dying to prescribe PAS since it has less negative connotation. The purpose is to help people who desire hastened death to avoid further suffering.
Their plans are, first, to be there for dying people who seek their help. They want to be skilled in counseling and be able to supervise if the suicide is justified or not. Some people are dying and want a careful release from this world. This depends on the patient's circumstances. Second, they want to eliminate taboos and fears of abuse of PAS that people have. They want the subject of hastened death, assisted suicide, and voluntary euthanasia to be put out in the open to be discussed. They want more investigation and writings on the subject in a compassionate way. They want to introduce PAS in better ways into literature, media, and the arts so that it is a commonplace thing to hear about.
Thirdly, they want a few physicians in different countries to become involved in criminal proceedings who have assisted death on request. They want them to fight to help patients who are suffering, rational, and want the option. Ultimately, they want the laws on homicide to be changed to allow somebody accused of a mercy killing to be able to plead justification and necessity. Their final statement is this: we are fighting for the ultimate civil liberty, the right to choose to die when we wish and how we wish, no matter what it is called.